Hi, everybody. My name is Jay Duncan. I am a local birth doula and childbirth educator. I've been doing both of those things for about 16 or 17 years in the Greater Victoria area. I'm so sorry that I can't be with you in person in regards to the Connecting Pregnancy session, but due to COVID-19, this is the best that we can do. So my job is to talk to you guys a little bit about what doulas are all about. So we'll probably start off by doing just that. We'll talk a little bit about what doulas do. We will talk a little bit about what doulas do not do. We will discuss a little bit about the statistical evidence in regards to how doulas have benefited the maternity world. And then, of course, we'll end this by talking a little bit about how the doula support has changed due to COVID-19. Okay? So why don't we get started? I find every time that I tell people that I'm a doula, the first thing that they say after I do say that is, "Oh, what's it like being a midwife?" And I think what people do is they distinguish a doula and a midwife as being exactly the same thing. So I'm here to tell you that they are not the same thing. And one of the main differences is that doulas do not offer any kind of medical services or advice. So we basically offer physical, emotional, and resource finding support. So that is basically the main thing that doulas do. So we cannot listen to your baby. We cannot do your blood pressure. We can't prescribe any drugs, anything like that, anything medical. That is going to be up to your midwife or your doctor if you are cared for by a doctor. One of the things that doulas do is that we provide continuous support. So that is really, really crucial, which means that we will not leave your side until the baby is born. And that is really right up until early labor, until literally the baby is born. We usually stay, and that's regardless if it's born at a hospital, if the baby is born at a hospital or the home or the cottage at the roundhouse. I usually stay at least a couple of hours after the baby is born to make sure that that birthing person is being taken care of and you are fed and you get to go into the shower. And I usually leave until everybody is settled down, and then I leave at about 2.5 hours after the birth. And I'm usually there at the home in early labor. And so through early labor, right up until the baby is born, I usually do not, and most doulas do not leave your side. So you get this awesome continuous labor support. We do not work on shifts. So unlike the nurses who have to have a certain shift, 7 to 7 or 7:30 to 7:30, you don't get that with a doula. So the doula that you have at that labor is going to be the doula that's going to be there for the whole time until your baby's born. We provide prenatal support too. So the first time that I see you is not going to be at your labor. We probably would have established a relationship probably a month to a month and a half before the due date of your baby. And that gives us an opportunity to sit down and talk to you about the kind of birth you would prefer or what kind of preferences you have. How can I best support you? How can I best support your partner? So by the time that we are in labor, or I should say you are in labor, I've got a pretty good idea of how I'm going to support you and your partner. And I have a great idea about the kind of birth that you would like. Do you prefer to have no, pain meds or some pain meds, or you want to do this all natural? We will have known that before we get into the labor situation so that there's not a guessing game going on. I do not charge you an arm and a leg. I think that most doulas you'll find are quite reasonable considering the hours that we put in, not only in the prenatal part, but also in the labor. Most people who hire doulas are usually first-time parents, and so they tend to have longer births, anywhere from 12 to 24 hours. And like I was saying, I may not be there in the very, very, very early stages of labor, but I am there in the mid-stage, early stages of labor, right up until the birth. So that if that does take 12, 15, 18 hours or 20 hours, I'm usually there the whole time. And then I tack on postnatal visits. So most doulas give at least 2 or 3 postnatal visits, usually one within 24 hours of the birth, and then another within a week of the birth, and then maybe the next one at the second week of the birth. So with all those hours, and each of those visits could be an hour and a half to 2 hours. So with all those visits, including all the prenatal time, when you really kind of look at what most doulas charge, it really isn't that much. I am at the kind of the top of the pay scale as far as doula is concerned, and I charge $950 for all of that. So most doulas are in the $500 to $800 range, and many doulas offer a sliding scale, or I even actually offer payment plans. And some of the newer doulas who are coming out of training, specifically with the Mothering Touch training program, they are actually offering their services at about $100 because they're just new, but they have had the training. So if you are interested in having a doula, but you just don't, that just does not fit in your budget, you can definitely seek the Mothering Touch for newer doulas that are on a newer list who are looking for more experience. We're with you during the early phase of labor, which is really important because most midwives and of course your doctors are not going to be there with you in early labor. They were basically going to want to be there, and actually they basically have a job to do when you are in a good active phase of your labor. That really means that your contractions are about 3 minutes apart. Each contraction is about a minute long. That's been going on for about an hour or 2 hours at your home, and we're talking about the intensity of pain has gone up. But before that, the active labor phase, a lot of doulas do not mind coming to your home and hanging out with you and counting contractions for you, or even sleeping on your couch so that you can be relaxed and have a little rest. Because what we do talk a lot about early labor in my childbirth classes is that the main thing is you need to get some rest in order for that body to deal with the challenges of active labor. So as new parents, sometimes we don't know when it's time to call the midwife. We don't know when it's time to go to the hospital. So what a doula can do is help you with those decisions so that it's not all what's going in your head and there's not a lot of questions, but the doula can time your contractions. They can witness how what your behavior is like during that the labor, and they can decide whether it's time to call a midwife, or they can decide whether it's time to head to the hospital. We want that midwife there, or we want you heading to the hospital in good active labor. Okay. We help partners find their confidence. There is a myth out there that sometimes the doula takes over from the partner, and that is absolutely as far from the truth. Doulas recognize that this is the partner's experience as well, and we are there to enhance the experience. So depending on what your partner's comfort level is, that's what we're going to help. If your partner wants to be as hands-on as possible and wants to do all the massaging and the helping you with your labor and helping with your breathing, then we're going to help him or her do that for you. If we have a partner that's really not confident at all and wants to be hands-off, then we will kind of go in there. But you have a special relationship with your partner that I do not. And so there's going to be things that this person is going to say to you that's going to resonate a lot better than what I say to you. So I'm part of the team as well as your birth partner, and I am certainly not there to take over that role. I'm actually there to make it more comfortable so that that partner can really focus on supporting you and not worrying about how to time contractions, when should we call the midwife or doc, when should we be heading out to the hospital, is her moaning okay? All that kind of stuff would be helpful if you had a doula around who could tell you, you know what she's doing is totally normal, keep doing what you're doing, okay? We are very non-judgmental, regarding your birth preferences. There is a myth out there that says that I won't have a doula because I'm planning to have a hospital birth, or I won't have a doula because I'm planning to have an epidural, or even I won't have a doula because I'm having an elective cesarean. There are lots of ways that a doula can support you with all kinds of interventions, be it an induction, an epidural, or even an elective cesarean. So whatever kind of birth you are planning or whatever preference you have, the doula's job, we're kind of like chameleons. The doula's job is to kind of, support you in whatever birth you want or whatever birth you are preferring. So it is not all about just vaginal births and Enya playing and all this, sage in the room and all that kind of stuff. That's not what a doula is all about. If you want that, that's awesome, and I'm going to try to support you to get that kind of birth. But if your birth goes down another type of road, I'm going to be there to support you. So I have no preference whatsoever as far as how you should birth. My job is to make sure that you get the birth that you want and to make this as a positive and empowering experience, no matter what kind of birth you have. Okay? We work seamlessly with the medical team. We are part of the team. There is not a them and us. I am part of the team. I do not have the skills that the nurses, midwives, doctors, obstetricians, pediatricians have. But they also sometimes, except for sometimes the doctors and midwives, we all have a really good relationship with you because we have talked to you and we have formed a relationship with you sometimes months and months well before you're in labor. So we do have that advantage going in, is that we know you before we go in. But I never, I never look at it as a them and us. I work, like I said, it's a birthing person should have a birth team, and I'm part of that team. And everybody has got their specialities or their specialties, and that's how I work. Okay, that is basically what doulas do. What I'd like to talk a little bit about is what doulas don't do. So what doulas do not do, and I've mentioned this before, is that we cannot offer any medical advice or services. So even if you come to us with a question like, well, I'm not comfortable with the bleeding that has happened, or I'm feeling a cramp right at the lower quadrant of my tummy, we are never going to diagnose that. In fact, my default is always, you need to talk to your caregiver about that. You need to talk to your midwife or your doctor about that. So we would not be able to diagnose anything. That is completely out of the doula scope because we don't have that training. Like I mentioned before, we do not work on shifts, hence you get continuous labor support from us. So we're usually there the entire time of your labor, and it's that one person other than your partner, who, and sometimes even the midwife, is going to be there the entire time of your labor. We cannot speak to the medical team on your behalf. What I can do is, and that's something sometimes is a little bit confusing because I think the word advocacy is sometimes misused in regards to doulas. I can advocate for you as far as letting people know what kind of preference you would like, as far as how you want to be touched, how you don't want to be touched, the kind of room that you would like, the dimming of the room, all that kind of stuff. I can relay that to the medical team, but I certainly cannot ask any questions in regards to your health or the baby's health on your behalf. What I can do is I can suggest questions that you can ask your midwife or your doctor. So the doctors and midwives don't want to hear from me as far as questions I may have about your medical health. They want that coming from you, and I would help to remind you about some questions that you may want to ask. I do not take the place of your partner, like I was suggesting before. We work as a team. There's a saying out there that says that the doula is your right hand and your partner is your left. And so there's going to be ways that we're going to work together, and there's going to be ways that one of us may be able to be of kind of more assistance depending on what the situation is. But I am never going to take the part of that partner. That is your partner's birth, and my job is to make sure that that partner is as engrossed in that birth if they want to or not. In our prenatal visits, we're going to have a lot of discussion about the partner and what role they want to have in this process. We cannot teach childbirth, the process of childbirth during your labor. Because I'm a childbirth educator, I know that there's a lot of people that sometimes hire me as a doula because they know that I teach childbirth education. It's one thing to teach childbirth education, and there's another thing to support a woman or a person during labor. And it's really hard to do both. So I would advise you to still seek a childbirth education course, and I will talk a little bit about what childbirth courses are available and how they may be changing actually in regards to the COVID-19 too. But yeah, don't think that you're going to learn about labor during your labor. You're going to be much more focused on getting through contractions and breathing through contractions and adopting different positions rather than me explaining to you what is happening, what is your uterus doing, what is your cervix doing. That is reserved honestly for a childbirth class.